Heart disease is the leading cause of death in the U.S., killing 1 in 5 Americans, according to the CDC. In tonight's edition of Feel Great Today, we'll talk about the risk factors and how to lower your risk of developing heart disease.
Feel Great Today with Jessica Jukic.
Every decade that people age, that increases the risk of the onset of heart disease.
Dr. Michael Zevitz is a cardiologist at Aspirus Cardiology Rhinelander. He says people should pay attention to their heart health at a young age.
People should get their first cholesterol check at age 20. That's the recommendation. Hyperlipidemia should not be ignored for decades. If it's elevated, it should be treated or certainly addressed. I would say certainly starting in the mid-30s, people should start paying attention to looking at risk factors that lead to heart disease.
Those risk factors include obesity, smoking, drinking alcohol, sleep deprivation, and stress.
Physiologic or psychological stress can lead to vascular disease. It also can lead to elevations in blood pressure. It can also adversely affect cholesterol level. Try to basically learn how to dissipate or relieve the stress.
Dr. Zevitz says there are various heart disease symptoms that people should not ignore.
The earliest symptoms of heart disease are shortness of breath on exertion, increased fluttering or palpitations that might indicate an arrhythmia. Likewise, the onset of chest pain, either on exertion or certainly at rest. Chest pain that occurs at rest, where there's a heaviness or tightness or squeezing sensation that occurs at rest that lasts for a few minutes.
To lower your risk, Dr. Zevitz says you should focus on eating lean protein, vegetables, and fruits, along with staying active.
It doesn't have to be necessarily strenuous exercise. Something that is done at the very least 3 times a week. The recommendation is to be, between around 5 to 7 days a week for about 20 to 30 minutes a day.